Knee pain is pretty common. 80% of people at some point will feel knee pain, tightness, or experience lack of movement in one or both knees.
In this video, we'll talk you through the basic anatomy of the knee, which will help us explain some of the root causes of issues known as runner's knee, bursitis, and tendonitis, and the sort of different symptoms you might have with each.
We'll give you a little guidance wherever to rest your knee, when to keep it moving, and when to go and get advice from a specialist.
I'm Nico.
And I'm Giuliano.
We're specialist physiotherapists here at the Clementine Churchill Hospital, part of Circle Health Group, the largest independent healthcare provider in the UK, with hospitals across the country.
It's useful to have an idea of the structure of the knee, how it moves and functions, before we go into where things can go wrong. This is a knee model. As you can see, the knee is a complex structure. It's made of bones, it's made of tendons, ligaments. What we have here, we have four different bones, which are the femur, tibia, the fibula, and the kneecap, which is the patella bone. All this structure, they are connected with ligaments. We have here the lateral collateral ligaments, the medial collateral ligament. If we go inside, we can see the anterior cruciate ligament and the posterior cruciate ligament. Now, inside the knee, we have what we call the lateral meniscus and the medial meniscus here. These are like cushions. They call like a shock absorber because they absorb the shock whenever you run, whenever you jump. What is important is that all these structures, they work perfectly together to allow a good flexion of the knee, good extension, and tiny rotation. If one of these components doesn't work properly, you might have knee pain, and in future you might have an injury.
When tissues break down, tear, or become inflamed, you could have one or a combination of arthritis, bursitis, tendonitis, runner's knee, or an injury or fracture. So let's get into it.
So something that we see very often is an injury that is called runner's knee. Like the name suggests, it's common with runners, but it can affect active people that do different sports, as the impact of running or overuse can take its toll on the patellofemoral tendon. The medical name is patellofemoral pain syndrome because it affects the patellofemoral joint. It's
often tight hamstrings or tightness along the IT band, which causes an imbalance in the thigh muscles, which can help to bring on runner's knee.
The pain you experience could be a sharp and sudden pain, or it can be even a dull ache. The pain will be at the front of your knee or at the back of your kneecap.
As physiotherapists, we would give you movements, exercises, and ways of stretching or rolling the muscles to realign your pattern of movement.
Over time, applying ice and working on these movements at home can help to reduce symptoms.
However, if the pain is severe or the knee is swollen, then it is always a good idea to have it looked at properly by a consultant to check if there is any ruptures within the knee or severe injury.
Another reason for knee pain that has similar causes and symptoms is the tendonitis of the patella tendon.
Tendonitis is primarily due to inflammation. Patella tendonitis specifically is caused most of the time by overuse, repetitive movement, and an unbalanced load on the tendon.
You'll have quite a sharp throbbing pain in the front of your knee, particularly when exercising.
It's sometimes called jumper's knee, as it's common in sports such as basketball, football, and running.
You also may have some swelling, bruising around the joint, redness, as well as general day-to-day discomfort.
You're more likely to develop tendonitis if you're not warming up properly before exercising. But other causes could be having flat feet, a weak core, or wearing the wrong footwear might increase the chances of you developing patella tendonitis.
We will work with you depending on what your specific goals are, and we want to help you to understand how your body works in order to avoid any flare-up of inflammation.
We would help you correct any patterns in your movement or in your lifestyle that could be adapted to help your knee heal and prevent tendonitis in the future.
Another common but quite different cause of knee pain that we see is called bursitis.
Your bursa is a fluid-filled sac that cushions your main joints. It sits between your bones and tendons to reduce friction that is caused by movement. Any joints can become affected with bursitis, including your knees. However, it is actually more common in your hips and your shoulders.
So with bursitis, you'll feel sore and tender. There might be some swelling and you'll feel warmth.
It's generally caused by repetitive movements and putting pressure on your knee, such as kneeling down when you're doing gardening or doing DIY. The bursa becomes irritated and is actually best treated with rest and painkillers.
This is the best way for it to heal. If you find the pain is getting worse, then you're definitely best to see a specialist consultant, as it can also be caused by something different, like an infection of the bursa, which will need medical treatment.
Osteoarthritis is by far the most common cause of chronic knee pain in older age.
As we age, the cartilage in our knees can deteriorate and break down. The surface of your knee cartilage can become rough and you feel this as a dull ache to begin with.
The pain will worsen if you've been on your feet all day, if you've been on a long walk, or you've been out all day at a game of golf.
With osteoarthritis, you'll have swelling, stiffness, and likely have pain when you bend your knee. And you may even hear a crunch or cracking sound when you move.
There are other types of arthritis, such as rheumatoid arthritis, but osteoarthritis is the most common.
Once your consultant has given you a diagnosis for osteoarthritis, we would work alongside you to help you strengthen your knee, keep it mobile, reduce pain, swelling, avoid that the pain gets worse, with simple physiotherapy exercise that you can do at home.
If you have arthritis and you're looking for some simple but effective exercises to help with strength, mobility and pain relief, we have more videos on our channel where our team explain exactly what you can do.
If you have rheumatoid arthritis, you likely have already had a diagnosis and your knee pain will be a development of joint pain symptoms that may started some time ago, likely in your hands, hips, wrists.
While your consultant may recommend some physio for rheumatoid arthritis, much of the treatment will be around managing your pain and inflammation with the correct medication and perhaps a steroid injection. Your consultant, however, will advise you on this.
We also have a video on rheumatoid arthritis, which we link to below.
Knee injuries can range from anything like dislocations or traumas, fractures of the bone, or ruptures of the tendons and tissues inside the knee.
You might know exactly when something happened or find that ongoing pain begins to intensify over time. We'd advise you to speak to a consultant for tests and a proper diagnosis if we think there is severe damage.
Some injuries can heal over time with the right amount of rest, support, correct strengthening and mobility work. But we would refer you onto a consultant for scans and tests if we think that there is an injury that may require further treatment.
Particularly bad injuries such as tendon and ligament tears, most commonly is the ACL damage. Often requires surgery to fix the ligament back onto the bone.
With these sorts of treatments, we would support you before, during and after your surgery, but would all be led by your surgeon.
So that was a brief overview of some common causes of knee pain, ways you can manage your knee pain at home and when to get advice from a physiotherapist or specialist consultant.
If you want to find out more or want to book a physiotherapy session here at the Clementine Churchill Hospital, you can call directly or alternatively you can book online via the link in the description below, or search for your nearest Circle Health Group hospital in your area at circlehealthgroup.co.uk.
If you have any questions or anything we covered in this video or would like a video on recovery from different types of treatments or problems, please comment below as we'd love to hear from you.
Otherwise, thanks for watching.